Okay, so it's starting.
Okay, so I'm going to talk about the position that we advise the AMA to stand on. We believe that the AMA should support the federal legislation in order to permit pharmacists to provide ambulatory care services to patients in medically underserved areas. But we believe that their PharmD degree is not sufficient enough. We would like them to have something in addition to their PharmD degree. We would like something like a residency or some kind of certification that we would advise them to provide so that they can provide such services to our standards to the patient. Okay, so we believe that having such certification or residency will not only expand or provide more education to the pharmacist, but it can also expand the role of the pharmacist. We believe that doing this would also help them to operate in their scope of practice. So we have different reasons why we chose to have this position, and the first reason is that we're concerned about the pharmacist education. Because of our concern, that's why we brought up the situation of having some kind of certification. Also, we believe that, just like Marcel said earlier, in the future there's going to be physician shortage. We do not think that the pharmacists will take over the role of the physicians, but we know that pharmacists can assist with patient education and also improve the patient's quality of life. So we would like that, since there's going to be a physician shortage, that the pharmacists be allowed to provide care and also to bill for their services. Okay, so we looked at a couple of clinical trials, and Marie's going to talk about the clinical trials that we looked at, but we saw evidence in the clinical trials that there was an improvement in medication adherence. The patients were able to stick closely to their therapy, and they were able to get better sooner. We also saw a reduction in costs, and we saw increase in patient outcomes, and then also an increase in the patient's quality of life. So these are the few reasons why we chose the position that we stand on. Marie is going to come shortly to talk about the clinical trials and why we chose them.
Beautiful.